Well, good morning, everybody. Russ Barkley back again for your weekly Saturday Research Roundup. And as always, we'll start with a dad joke, and that is, why do cows wear bells? Because their horns don't work. I know, that's really bad. So you can have a look at the internet for plenty more of these corny dad jokes if you're interested. So, welcome back, everybody. And in this review, we've got 5 articles to cover in brief. So let's get started. First up is a paper that was published last week in Translational Psychiatry. And it is a study that looks at the genetic risks for several disorders: major depression, ADHD, neuroticism, and schizophrenia, and it looks at the genetic risk posed for intimate partner violence. So this is a very important study because it's looking at how likely are you to have a disorder given that you have many genes for that disorder, and how likely is that then to lead to experiencing various types of intimate partner violence. So let's have a look, because this is a large population study. It is based on 11,000 women of European ancestry, and it went on to compute the extent to which they carried genes for these various disorders, known as a polygenic risk score, and they compared women who were in the top 20% of having these genes compared to women in the bottom 20% of having those genes. So the extent to which they had more genetic risk for these disorders compared to the extent to which they didn't. And then they went on, as I said, to look at various types of intimate partner violence. And what did they find? Well, as it says here down the abstract, it says that in this cohort of women, participants who were in the highest quintile, 20% of genetic risk for ADHD, major depression, neuroticism, which is kind of like anxiety with depression, and schizophrenia, and those with an overall genetic risk for any of these disorders were at the highest risk of experiencing more severe emotional and physical abuse, and more severe sexual abuse, as well as more types of abuse and chronic abuse. The exception to that was schizophrenia was not prone to sexual abuse. But overall, we're seeing that people who are prone, in this case, to high genetic risk for ADHD also carry a high risk of experiencing various kinds of intimate partner violence. And it further goes on to show that especially those with a high risk of ADHD were at risk of experiencing harassment from their partner, besides those other forms of partner violence. So this fits in with other population studies that have been done. This one happens to have been done, I believe this was up in Canada. And the importance of this is that it's a large population study. It certainly agrees with the previous studies that have been done using smaller populations and follow-up studies, and shows the high risk that ADHD, among other disorders, poses to women at increasing their risk of experiencing such forms of harassment and violence. Okay, so let's go on to our next study. This is on the prevalence of cannabis use in people with ADHD. It's a meta-analysis. We've already talked about this in earlier research reviews, but I thought you might be interested in seeing that this review comes up with a very similar result to the prior studies and prior reviews that we've talked about. And this paper, published over in the Journal of Psychiatric Research, reports that the lifetime prevalence for cannabis use disorder was nearly 27% of the sample that had ADHD, and for current cannabis use disorder was about 20%. So overall, ADHD creates a 3 times greater risk of experiencing cannabis use disorder, not just cannabis use, but disorder, which means extensive or excessive use of the substance. So there's a 3 times greater risk that ADHD is going to pose for this kind of cannabis use disorder. Okay, let's go on to our third study. This is on ADHD medication use and the risk of accidental injuries and all-cause mortality. This is a population-based study, and this one is looking at over 217,000 individuals in the population, and this one was done in the health records from Quebec, and it is comparing those who were on medication to those who did not take medication, but it also compares the same individuals when they were on versus when they were off medication. That's a very important comparison here because it's controlling for a lot of other possible confounding factors known as a within subjects comparison. And what they found was that compared to periods when they were not using medication, periods when these individuals were taking their ADHD medication were associated with an overall reduction in all-cause mortality by about 40%, by the way, as well as a 25% reduction in unintentional injuries and about a 30% reduction in hospitalizations related to those injuries. So they point out that episodes of stimulants were associated with a much lower risk for mortality and for unintentional injuries. They also looked at non-stimulant medications, and there they found that the use of non-stimulants also resulted in a reduction in unintentional injuries, but not in all-cause mortality, which would include things like suicide, homicides, and other forms of early mortality. So once again, we are seeing this is but one of many studies now out there using population databases to show that ADHD treatment with medication, particularly with stimulants, reduces the risk of mortality while they're on their medication. And it looks like the non-stimulants do help to reduce risk for unintentional injury, but not for the other forms of mortality. Okay, let's move on to our next study, which I think is important. This is on looking at the risks posed by continuing your dexamphetamine stimulant medication during pregnancy compared to women who discontinued by the second trimester compared to women who had ADHD but did not take medication going into their pregnancy. So a very important look here at how does medication continuation during pregnancy affect the mother's health and the immediate post-delivery, the immediate neonatal health of the child. So let's take a look down here because we're looking at a large population study from Western Australia here. If I didn't say it, this was published over in the Archives of Women's Mental Health. And it is comparing 547 women who continued their medication versus 297 who discontinued medication by the second trimester versus a group of women, 844, who did not take medication during their pregnancy. What did they find? Compared to those who continued their treatment, those who ceased medication by the second trimester had higher rates of threatened abortion, meaning a higher risk that they might be experiencing symptoms of abortion, spontaneous abortion, or indeed experience such an abortion. They found that those who had never been exposed to the medication throughout all of the pregnancy, when compared to those who continued during the pregnancy, they found that those who discontinued had a lower risk of preeclampsia, a lower risk of hypertension, a lower risk of postpartum hemorrhage, and a lower risk of having their neonate admitted to the neonatal intensive care unit, as well as a lower risk of fetal distress. So overall, finding some benefit to continuing your medication, and that is reduced likelihood of early abortion, spontaneous abortion. On the other hand, by continuing it, it increased the risk for some other factors. So the authors go on to conclude that they need an individualized approach to deciding whether to continue medication or not continue medication. And obviously, these risks and advantages need to be discussed with these women during this discussion about, do I continue medication or not? Now, two things that were not looked at in this study that I think are important to consider. Number one, it's very possible that the women who continued on their medication had more severe ADHD symptoms than the women who did not continue on their medication. And there may be something about severity of ADHD in pregnant women that alone predisposes them to have these various problems with preeclampsia, hypertension, hemorrhage, and so on, those risks that were found in those who continued versus those who discontinued medication. So again, it doesn't necessarily mean that it's the medication. It suggests that it is, but it's not a direct causal study of medication leading to these outcomes. It's a correlational study. And as you know, we've talked about it here before, correlation doesn't mean causation, but it is reason for concern and for discussion with these women. Now, the other thing that was not reviewed in this study, but has to be discussed with these women, is that if you discontinue medication, what risks are you posing for yourself apart from these health risks to you and the baby during your pregnancy? What about car accidents? What about intimate partner violence? What about depression? What about suicide? And so on. There are so many risks posed to women who are not taking their medication, risks of losing their job, and so on. Not to mention the academic risks if they happen to still be in an academic setting. So that has to be weighed here. We're not just looking at the physical well-being that's associated with that pregnancy and health-related outcomes. We need to look at the total picture of risk and discuss that with these women to decide whether or not they should continue with their medication. So again, it's not a very simplistic answer here. It's a very complex issue that needs a lot of heartfelt discussion with the women who can then make up their minds as to what is the greater risk being posed here by continuing or not continuing medication. All right, our last paper that I want to talk about is the review that appeared over here in the European Journal of Medical and Health Sciences. It's a review. It's a detailed review. There are some problems with this review. When I went through it, I find that it's not an especially critical review, but it's an important review because it talks about the psychosocial consequences of ADHD in females. And if you check out the website where the article is, you will be able to read the entire article. It goes through about 200 or more articles published on women with ADHD, and girls growing up with ADHD, and talks about the themes that appeared across these studies in terms of risks, problems, as well as perhaps some advantages of having ADHD. So we don't have time to go through this entire review. They kind of take it study by study, section by section, theme by theme. But if you're interested in reading more about what research has found in girls and women with ADHD, then have a look at this review paper over there at the European Journal of Medical and Health Sciences. So that said, as you know, I always put the link in the description for the articles that I discuss. And as you know, I only review published articles. So I don't take a look at dissertations or theses, but those that have been subjected to peer review and are now appearing in the journals. So I hope you found this review interesting this week. I did. And that you'll have a look at some of the other studies that I list in the description. There's a bunch of papers that were published. By the way, if I don't review a study, it usually is because the study is not very well done, involves a small sample. Perhaps it simply reiterates points that have already been made in the literature. In other words, there's nothing new there. And so I don't showcase it in my discussion during these weekly reviews. So thanks for joining me this week, everybody. I really appreciate your tuning in to this channel. If you're not a subscriber, as I always suggest, think about subscribing to the channel. If you are, thank you very much for being a subscriber and following my work on this channel. And as always, if you know someone who might benefit from this information, please recommend the channel to others. Okay, everybody, have a great weekend, and I'll be in touch next week with more topics on ADHD. Thanks for joining me.